Hi guys, I'm just gonna set up my screen so you guys are able to see my PowerPoint. Okay, so I chose to present on the subject testing anxiety. Introduction. In this PowerPoint, I will be referencing from 3 short articles on the topic test anxiety. I chose 3 short articles because when I was researching, I found that the articles that I thought were interesting and most relevant were kind of short, so I thought to just combine them all into one PowerPoint. My first article is Demographic Factors and Test Anxiety Among Secondary School Students. My second article is Test Anxiety and Its Determinants Among Health Science Students at Matthew University, which was a cross-sectional study. My third article is Hypnosis Intervention for Reducing Test Anxiety Among Students, a systematic review. Before I get into the articles, I thought to define test anxiety, provide some symptoms, and then the causes. Test anxiety is a combination of physical symptoms and emotional reactions that interfere with the ability to perform well on tests. Many students experience varying levels of test anxiety for a number of different reasons. If you're someone who does, check out these suggestions and resources to reduce your test anxiety and improve your overall testing experience. Symptoms. Physical symptoms: headaches, nausea, excessive sweating, shortness of breath, rapid heartbeat, lightheadedness, and feeling faint. Test anxiety can also cause panic attacks, which are abrupt onset of intense fear or discomfort in which you may feel like you are unable to breathe or like you are having a heart attack. Emotional symptoms: feelings of stress, fear, helplessness, disappointment, and negative thoughts, which include rumination about poor past experience performances, consequences of failing, feeling inadequate, and being helpless. Your mind going blank and racing thoughts. Behavioral and cognitive symptoms: difficulty concentrating, thinking negatively, comparing yourself to others, and procrastinating. These are the causes. Fear of failure. While the pressure of doing well on an exam can be motivating, it can also be detrimental to your self worth if you associate the grade of your test with your value. Lack of preparation. Waiting until the last minute or not studying at all can leave you feeling anxious and overwhelmed. Poor test history. Not succeeding on the previous exam can make you anxious for the next exam. It is important to remember to stay in the present moment when taking an exam so you remain focused. Don't dwell in the past. High pressure. If you need a certain grade to pass the class, it could increase your test anxiety. Perfectionism. Perfectionism is having extremely high performance expectations for yourself. Research studies show that students who have high perfectionism and high self criticism tend to have high test anxiety and do worse on exams. If you struggle with perfectionism, try to let it go. Make sure to take the time to recognize when you have worked hard and allow yourself to make mistakes. My first article: Demographic Factors and Test Anxiety Among Secondary School Students. This study was based in Nigeria. The purpose of this study was to determine levels of test anxiety in secondary schools. This study analyzed demographic factors when observing test anxiety. They took a sample of 240 students to participate in the study. A questionnaire called STEAM was used to collect data. And STEAM stands for Students Test and Examination Anxiety Measure. They found that 50.8% had low testing anxiety, where 49.2% had high testing anxiety. The study concluded that anxiety was physiological and without a relevance to gender. It was recommended that intervention programs developed must not be gender biased. Second article: Test Anxiety and Its Determinants Among Health Science Students at Matthew University, a cross-sectional study. Test anxiety was defined as severe stress before, during, and after exams. This study aimed to determine levels of test anxiety and its determinants among health science students at Matthew University. An institution-based cross-sectional study was conducted with 421 students participating. The Oslo Social Support Scale, the Roseberg Self-Esteem Scale, and the Kessler Scale was used to assess. A linear regression model was used to determine factors associated with test anxiety. The study found that substance abuse and psychological stress exacerbated testing anxiety, whereas self-esteem and physical exercise alleviated it. And I had to Google what a linear regression model was, so I just thought to provide the definition for you guys up here. It's a straight line graph that shows a relationship between the x coordinate and the y coordinate. My third article: which I think was the most interesting. Hypnosis interventions for reducing test anxiety among students, a systematic review. In this article, it stated that there had been 445 studies completed on the effects of hypnosis in regards to testing anxiety. Hypnosis has lasting effects on the stress associated with test anxiety, and findings show that hypnosis truly helps decrease testing anxiety. And that is it for my presentation. I hope you guys enjoyed this presentation, and I recommend you check out the articles because they are very interesting. Thank you.